BellaVet. Today I'm joined by the amazing Dr. Val, and I've known Dr. Val since I was in high school. She was actually one of the veterinarians that I worked with to get some experience hours in order to apply to vet school. And Dr. Val is an emergency veterinarian who works for an organization called VIN, the Veterinary Information Network. And VIN is a really amazing online resource for vet students and veterinarians. And they also have a nonprofit branch called the VIN Foundation, and the VIN Foundation produces some really amazing programs for prevets. So like I said, Dr. Val has started working for VIN, and tell us a little bit about what you do.
So what I do at VIN, I'm actually part of the member relations team. So my job is helping new members learn how to navigate around VIN and making sure that they have everything that they need. So part of this also translates over into some of the work I do with the VIN Foundation, which is reaching out to students and pre-vet students to kind of help them realize some of the resources that we have available for us and some of the things that we can do to help them as our future colleagues.
So today we're going to talk about things that the VIN Foundation and VIN produce for pre-vet students, for vet students, and for veterinarians. So we'll start off with some of the amazing resources that the VIN Foundation puts out, and if all goes well, we'll have a little screen grab in this corner. Okay, so the first thing that the VIN Foundation produces, we will show you their homepage. If you go to vinfoundation.org, you'll see this homepage, and you can click on I am thinking about being a veterinarian, and it will show you the cost of education map and the student loan repayment simulator, which is what we'll be playing with today. So once you click on the cost of education map, you can put what state resident you are. So I'm a Michigan resident, but I go to school in Missouri. So I've clicked on Missouri, and it has told me my in-state tuition, my out-of-state tuition, approximate living expenses, and the totals. So is there anything else we should know about the cost of education map?
One of the nice things about the COE map is it lets us kind of compare all in one spot different tuition rates for the different schools. So you may be considering as a pre-vet student, you know, hey, I'm looking at this school because it's in-state, but I'm also looking at a few other schools. And so what this map allows you to do is sit there and look and see what the difference in tuition is going to be. Obviously, you still have to apply to schools, and this isn't ranking them on anything other than how much your estimated cost is going to be, but it's a good jumping off point if you're trying to figure out where you're going to apply.
Yeah, awesome. So once you click on the student debt simulator, it'll ask you to put in some information. I put in my information, which would also be a similar information for anyone at my school who is an out-of-state student. So my graduation year is 2020, and I put in the amount that I expect to borrow. I arrived at this number through 1 year of out-of-state tuition and 3 years of in-state tuition, and that's because my school allows you to become an in-state resident after your first year. And is there anything else we should know?
So the student loan debt simulator, it's a tool, and basically we are not financial advisors, but it's a good jumping off point, again, if you're looking at, hey, I want to be a veterinarian, or hey, I'm in vet school, what are my monthly payments going to be? How long can I expect to be repaying these loans? And so what this allows you to do is put in your information, and then depending on the different repayment options that are available, which obviously can vary sometimes even from year to year, it gives you a general idea of how your finances are going to look kind of moving forward after graduation. So again, it's a tool that we can use when you're looking at going into vet school, when you're in vet school, just to try to kind of figure out what your future is going to look like.
Yep, sounds good. So Dr. Val actually first introduced me to VIN when I was still a pre-vet student. She showed me the chocolate toxicity calculator, which we'll show you guys a little bit later on. And then she showed me how awesome the VIN community is on helping you with some of your toughest cases and giving you some great advice and giving you a different perspective. And yeah, that's why I was so excited to join VIN in the first place, and that's why I think a lot of pre-vets and vet students should be excited to join VIN as well.
Absolutely. So, as a student, one of the first places that you'll probably land when you log on to VIN is the Student Center. And what we've done there is we've kind of collected all of the tools and tricks and resources that we feel are going to be most useful to vet students from 1st through 4th year. One of the really cool things that we've got that I really wish we had when I was in vet school is what's called Avala, which is our 3D anatomy tool. So I use it all the time in practice, but Rachel's going to talk a little bit more about how she uses it in her anatomy classes.
Yeah. So I'm a first year, which means I had small animal anatomy last semester, and I'm currently in large animal anatomy, and this tool is really helpful. So when you first log into VIN and you make your way to the Student Center, and if you click on 3D Anatomy, it'll bring you to this page, and you can find all the musculature and organ systems, and one of the most frustrating things for me to learn was the vasculature. So if I click on canine limb vasculature, it'll bring me to this page, and this is super cool because you can click on arteries and vessels, and they can appear, they can disappear, and if you zoom in, you can even click on the different arteries themselves, and it'll give you a little bit of information about them.
One of the other tools that's very helpful on VIN, and you can get to it directly from the Student Center, is the Associative Tool. So when I was a vet student, one thing that I had trouble with was sometimes coming up with rule-out lists. What you can do on Associate, if you click on it, you can go ahead and choose your species, choose your breed if it's appropriate, and then it will pull up a tool that you can use to actually put in clinical signs, physical exam findings, etc. And what that lets you do is it gives you a list of suggestions. So things to consider that could be wrong with your patient. And that's another good jumping off point for us when we're looking at what could our possible problems be.
Yeah, and today we have chosen a little mock case of a American Cocker Spaniel who came in with dehydration, vomiting, and icterus, which is
jaundice.
And one of the classic things that comes up with those 3 signs is problems with the gallbladder.
Yep.
And we put in those signs, that came up, and if we select this, and we look at the info on it, it'll tell us all about it, including the pathogenesis, the clinical signs and diagnosis, and everything that you would need to start off treating a case and learning more about it.
Yep, absolutely.
Yeah. Well, another really great thing that you can find in the Student Center under video libraries is the Mentor, and that is where VIN collected a series of videos of procedures that in vet school we'll either learn how to do or we'll learn about. And when you click on that, this is one of the pages that will come up. I've clicked on surgery, and if you could tell us a little bit more about it.
So with Mentor, you can read about procedures all day long, but until you actually see them either in real life or on video, it can be hard to visualize exactly what it is that textbook is talking about. So what we did was we took some very common procedures, nerve blocks, epidurals, castrations, and either produced videos or grabbed them from reputable sources and put them on here so that way you have another aid to sort of get an idea of what it is you're walking into before, your first day on your anesthesia rotation.
Yeah.
And it can be really helpful.
Yeah, for sure. Okay guys, so we're back to the Student Center, and if we scroll down, we can find the calculators. And if we click on the calculators, it'll bring us to this home page where we find the chocolate toxicity calculator.
It's your favorite.
It is my favorite, and it was the first calculator that Dr. Bell showed me all those years ago. And if we click on it, we can put in that we have a 50-pound dog who got into some milk chocolate, about a 10-ounce bar of it, and we hit calculate, and it shows us that this dog is going to have some vomiting and some diarrhea, but it's not quite up to the arrhythmia stage, and we'll be able to reverse it with the proper treatment. But this is just a really great, quick resource to use while you're out in practice, and there are so many other calculators like acid-base body surface area, and we were playing with the the coagulant calculator earlier.
Yes.
And yeah, it's just a great thing to use in practice.
Mm-hmm. They're really helpful for some of those situations where either you don't have time or maybe you don't feel like sitting there and looking up exactly how much theobromine is in, milk chocolate versus dark chocolate versus semi-sweet. That information's already there, so it's a great resource to use, just sort of as a quick, hey, I need to know this and I need to know this right now. So as far as veterinary medicine goes, there's two big elephants in the room. One is student debt. The other is, unfortunately, the issue of mental illness and depression within the profession. We are a profession that has a very disproportionately high rate of depression as well as, unfortunately, suicides. So one thing that the VIN Foundation is trying to do is to address those issues. So if you check out vinfoundation.org and go to programs, if you scroll down, there is a group called Vets for Vets. And that is a confidential support group that you can join, and you can get help from colleagues. So people who are there, who know the situation that you're in, who have maybe been there themselves. And it's not just for major problems either. It's for those new grads that are going, I'm having a problem with my boss and I don't know what to do and I don't know how to talk to them. Or, hey, I'm butting heads with a staff member. Or even just, oh my gosh, am I ready to be out there? We've all been there. We've all had a similar situation. And we want to reach out and make sure that our future colleagues are supported.
Yeah. Awesome. And hey guys, so last but not least, VIN has some really amazing resources for after you graduate when you are a full-fledged practicing veterinarian. And if you could tell us about some of those, that'd be great.
Yeah, so most of what we do at VIN is focused on practicing veterinarians. One of the things that can be super helpful as a new grad is we do offer online continuing education as well as online rounds, which when you're coming out of an academic environment, all of a sudden you're in a practice environment and you're not doing rounds and morbidity and mortality on cases. So that can be really, really helpful. You can post on the message boards and get advice from others in the community, specialists, other practitioners, what we call people in the trenches. And you can also have access to journals, search, drug resources, textbooks. There's all sorts of information on VIN that can be really, really kind of a lifesaver, kind of moving forward in your clinical career.
For sure. So VIN is also a really great community where members can help one another on their tough cases. And you had a instance of that happening pretty recently.
Yeah, I had a really weird, unusual presentation where I had a dog that physically I couldn't find anything wrong with them. Blood work-wise, nothing was wrong with them. X-rays, everything was fine. But this patient was keeping their owner up at night, and the owner was convinced that the dog was painful and uncomfortable. And obviously, as a veterinarian, that's something that's really important not to ignore. Our patients can't talk to us.
Yeah.
So I hopped on VIN, did a search, and within about 2 minutes, I had a few cases that were similar that it had been suggested to possibly treat them for heartburn, essentially. Well, that's what I did with this patient. And a couple days later, sure enough, they're sleeping through the night. They're more comfortable. And that's not something that I would have thought of without VIN. Even though I've been out for 10 years, oh God, there's still practitioners out there who have been out for 20 years, 30 years that have maybe seen different cases or seen more of a certain type of case than I have. And that's really where we are a community. We help each other out, not just specialists, but other people that have different experiences than you, and it's so, so helpful.
Yeah, absolutely. So guys, that's all we've got for you today, and I want to give a huge thank you to Dr. Val for coming on my channel.
Thank you for inviting me.
Absolutely.
This has been fun.
Yeah, I'll have to do it again sometime soon. And please, if you like this kind of video, give it a like, and don't forget to subscribe.